We welcome Dr. Machado from the Health First Urgent and Primary Care. Health First offers a variety of services, including chronic care, weight loss, and counseling. Good to see you, Doctor.
Nice to see you.
And the thing of it is, I'm glad to see the guy that owns the place that's here talking about it. On a personal level, I've been to you guys twice and have had wonderful and excellent care. I've paid for it myself and with insurance and all.
Yeah.
But just, you know, to go in the bedside manner, and we'll talk about the your facilities, the 4 different facilities that you have.
Yeah.
But the bedside manner that you guys give is so nice.
Yeah.
It's one of the most wonderful places to go for urgent care, for primary care as well.
It's a thing that makes God smile. It's really funny that the way we do it is not what I was taught in medical school.
Mm-hmm.
I got taught by a couple of great physicians along the way. One of them still works for us.
Mm-hmm.
And changed my practice dramatically.
Mm-hmm.
Great physicians and taught me how to hear the story behind the story.
Mm-hmm. And Doctor, you guys got 4 locations now. Last year, or going on this year, 100,000 visits.
Yeah, we're really, really busy. Busier than most of the trauma centers in town.
Mm-hmm. Tell us about the 4 locations. I know you have one right up Highway 17 north in Mount Pleasant here.
Yeah, we're basically north, south, east, and west. You know, the farthest north office is in Somerville, not far from the interstate on 17. A little bit towards Monk's Corner by One Light. And then we have the West Ashley office, which is sort of in the auto mile, easy to get to. And then, of course, the Mount Pleasant office you mentioned is at 17 and 41. And then we have the mothership, we call it, which is where we started, which is on Rivers Avenue. We're right up there by Stokes Honda and kind of in that neck of the woods. And yeah, we're the last driveway on Rivers Avenue, so we're busy.
And you've been a doctor for 30+ years now.
Yep, that's right. Yep.
Tell us about some of the folks that you do hire because you are looking for certain types of individuals to come in because you guys are expanding. But you guys go through an extensive process of interviews, psychiatric interviews with the folks that are coming aboard. You really want the folks that are working there to be just so user-friendly to the patients coming in.
Yeah, it's really interesting. We about a year or so ago, we really flipped the light switch on, and every one of our applicants now has to be interviewed by a psychologist. And we want to get what's behind what motivates them, what drives them. Do they have a servant's heart? Are they driven by taking care of patients? Are they going to be okay with not eating lunch till 3 or 4 hours after lunch because they're taking care of patients that are sick, that are there at noon?
That are waiting.
Yeah, and we're not gonna have doctors parking places, and we're not gonna eat lunch when lunch comes. We're gonna take care of patients first, and if you're okay with that, then you may be our kind of person.
Speaking of waiting, you've got an average wait of 11 minutes.
Yeah. The way we did that is by simply removing.
How's that possible?
Yeah, it's really crazy that the reason people wait in the trauma centers is not because of well-run systems. They usually have one triage nurse, for instance. So all of the emergencies is being funneled by one. They're all being funneled by one bottleneck that's created at the very beginning of the process. So they've already built in a wait. We just removed those obstacles. We just removed all of them. We got rid of every one of them. We got rid of the clipboards. We got rid of the bottlenecks at second touch and triage. We just tried to look at the places that didn't need to be there and get rid of them and stay with the stuff that works.
We've got about 45 seconds left. Tell us about some of the cases that you treat and what you're able to treat.
Sure. Well, we primarily started off doing emergency medicine, and our patients asked us to begin to do primary care. So now we do a lot of primary care, especially blood pressure and cholesterol patients. And then from that, we noticed that a lot of those patients needed just a little bit of weight loss, 25, 30 pounds, their cholesterol goes away, they're off those medications, and it pays for itself in less than a year. And then, as you might imagine, we're now doing counseling.
And with your facilities, the 4 different facilities that you have, when the people come in, you said you take care, you get rid of a lot of that paperwork. I remember going in, 1 piece of paper, and that was it.
Yeah, and that's a federally mandated signature that we can't get rid of, or we'd have gotten rid of it too.
And what are some of the folks that you're looking for right now that could come in and fill out an application?
We need really top-shelf office managers. We need top-shelf providers, physicians, and PAs. We are even flirting with interviewing some of the local orthopedists or even a retired orthopedist that wants to come to town to see our orthopedic patients. We have a high volume of orthopedic cases that we see, and of course the local orthopedists are seeing those now, but they're going to different offices, and we'd like to kind of make that more organized for them.
Health First, 4 different locations in Mount Pleasant, in the Charleston area, Rivers Avenue, North Main Street in Somerville, Savannah Highway, and North Highway 17 in Mount Pleasant. Doc, thanks for joining us today. Appreciate you coming in. We got more Low Country Live coming up in just a moment. Stay with us.